Good day, I am Zamzam Indika and today I am going to practice the insertion of NG tube. The first procedure, verify the medical order for insertion of NG tube, perform hand hygiene, and put on PP if indicated. Then identify the patient and explain the procedure. Gather all equipment and select appropriate NG tube. And this is my alternative NG tube. Then close the patient bedside curtains or door. Then assist the patient in a high polar position or 45 degrees position. And drape chest with bath towel or disposable pad. Then put on gloves. Then measure the distance to insert tube by placing the tip of the tube at patient nostril and extending to the tip of the earlobe and then to the tip of xiphoid process. Then use edible marker. Then next is lubricate the tube tip up to at least 2 to 4 inches. 2 to 4 inches. Then, after selecting the appropriate nostril, ask the patient to slightly flex head against the pillow. Then, gently insert the tube into the tip of the nostril while directing the tube upward and backward. Patient may gag when tube reaches pharynx. Provide tissue for tearing or watering of eyes. When pharynx is reached, instruct the patient to touch chin to the chest. And encourage the patient to swallow even if no fluids are permitted. Then stop when patient breathes. Then check the placement of tube with tongue blade or in flashlight. Then next is insert the tube until the pen marking is reached. Pen marking is reached. Do not use force. Discontinue procedure and removing tube if there are signs of distress. Secure the tube loosely to the nose or cheek until it is determined that the tube is in the patient's stomach. Then attach syringe to end of the tube and aspirate small amount of stomach content. Then measure the pH of aspirated fluid using the pH paper. Then compare the color on the paper with the chart supplied by the manufacturer. Then remove the gloves. Then secure the tube with piece of tape. Then next is put on gloves again. Then measure the length of exposed tube. Measure. Then ask the patient to turn to the head to the side opposite the nostril in which the tube is inserted. Then use pin or tape to secure and attach the gown or in the shirt of the patient. Then assist with or provide oral hygiene at 2 to 4 intervals. Then remove equipments and return patient to a position of comfort. Then remove the gloves. And that's for the insertion of NG tube.